is your friend, the Commissioner Stephanie Moore, and I'm welcoming you to my table for some table talk with my good friend, the incredible Denise Crawford. She is the CEO of our Family Health Center. She's doing amazing work in this community. And not only is she an amazing professional, but a beautiful wife and mother. And I'm just so excited to have her here at the table with me today. Hey, Denise.
Hey, Stephanie. It's always an honor and a pleasure to be with you. Thank you so much for having me.
How are you doing?
Good. You know, hanging in here. This pandemic is it's a bit much. It's an adjustment for all of us, but we are committed to make sure that we are here on the front lines and taking care of our community. So, again, we're with you every step of the way.
So on a personal side, ever since this has jumped off, you're in the healthcare field. That your work increased tremendously. How are you coping at home with family and making sure you're not contaminating the household?
Excellent question. Well, you know, I'm very fortunate. I have a wonderful family, very supportive. My husband has been amazing, as is my son. Similarly to everyone else, when this first, launched, we were concerned about, it was interesting. I kind of went through my list. And so I was focused on my husband, my son, my mama, and then my employees. People refer to it as my FHC.
Okay.
My son was actually at an internship in Orlando, and so we had to connect with him and fly down and get him back home. And as we all know, Walt Disney World shut down, so all of that was secured. We got him secured, and then I connected with my mother, fortunately, who lives here in town, and made sure that she was okay, and updated her exactly on what was taking place. And it was important to quarantine, etc. Talk to her about all of the risks, 6 foot apart, not going out. And so she was very compliant, and she decided to self-quarantine, where she still is and doing a wonderful job. And then equally important, moved to the health center and wanted to make sure that we had the appropriate PPE for our staff. It was already clear in my mind that we would be out on the front lines. We never thought about closing. We are the safety net, and so we have to be here for the community. That is our stance. It was interesting as we seen more and more primary care offices close. We've seen urgent clinics close. We've seen essentially specialist offices close, and we actually started to receive some scrutiny about staying open, only in the sense of, do you think that's wise, et cetera, as we look across the rest of the community. And we remained committed to staying open, but also taking the necessary precautions. To that effect, I think what's most interesting is through this time, we are seeing so many patients. We continue to see a large number of patients and our family health center patients. But interestingly enough, we're seeing tons of new patients that typically are not family health center patients, but just patients who need care and don't have access, don't necessarily require emergency room treatment, but they still need health care. And so they've been coming in. So those were really kind of my key buckets as I went through my head. And so far, everyone is doing well. The family's doing well. Obviously, my parents are doing well. And then, of course, my family health center family is doing well.
I am so glad to hear that. Let's talk a little bit about Family Health Center, your patients. How many patients do you have, and how many people do you see regular?
Interesting. So outside of COVID-19, Family Health Center, we currently have 43,000 active patients. So those are individuals that have entered our doors that we have provided care to at least 3 times over the past year.
Wow.
That's what we identify as an active patient. And so that number represents 43,000. Oftentimes people are shocked to learn that. They hear in Kalamazoo, where we have approximately 250,000 individuals throughout the county. When we look at the definition of our target patient population, particularly as it centers around underserved patients, Medicaid patients, underinsured, meaning those are individuals individuals who may have access to insurance but cannot necessarily afford the copays. And so we're able to offer them a sliding fee scale, as well as undocumented and homeless patients.
Oh.
That target market actually makes up 62,000 individuals in Kalamazoo County. And so again, we currently serve 43,000 of those individuals. During regular business operations, we see about 700 patients a day. And we provide about 100, last year we provided about 143,000 visits throughout the year.
That is so amazing. So really, if you think about it, Denise, you really couldn't. You have so many people that are counting and depending on you, not just for health care and health access, but you also have a pharmacy there where people may need prescriptions and such.
Absolutely. We have a full service pharmacy. We do lab draws. As you know, we have occupational therapy, physical therapy, OBGYN services, the full gamut of primary care, pediatrics, internal medicine, family practice, et cetera, substance use programs. So from our standpoint, again, as the safety net within the community, closure was never an option. And I am so proud of the staff that work here. That was never a question. They wanted to ensure the safety of themselves and their family members, again, making sure we had the appropriate PPE, but they were truly, foot soldiers on the ground. This is a pandemic. We have to take care of our patients. We have to make sure that things are appropriate and safe, that they have the necessary education and information. They trust us, they need us, and that's been their mentality the entire time. I'm very, very proud of my staff. I actually have a few that are actually carpooling, and they came from the Detroit area, and so they're very concerned about a lot of the disparities and challenges that are just taking place across entire Detroit. And so they actually carpool, and they go to Detroit on the weekends and provide they provide medical care there as physicians, just because of the need, and then they come back and get right back in it here back at home in Kalamazoo.
So morale-wise, the employees are doing good. Everybody is showing up.
Absolutely. Absolutely. So, as we evaluated this from an organization standpoint, what we felt was important is that we wanted to ensure the care and the safety, the dignity and respect of our patients. That's always key. But we also wanted to make sure that we were providing that equal level of care and compassion to our staff. And so what we offered right off the bat was compassion care. We indicated to anyone who works across the enterprise, regardless what position you held, that if for whatever reason you felt uncomfortable, that you could take time off, a leave of absence, and it would not be held against you. There would be no judgment, no questions, that we just simply understood. And it was important that you felt comfortable during this environment and throughout this pandemic. And so we've had people, they're actually allowed to take it in 2-week increments, because again, we have to make sure we can service the need. Fortunately, the majority of people, we did have some to take them. The majority of people have come back and remained. We have allowed some individuals to renew that process. And you can take that and you can use your vacation time. You can take it time off without pay, etc. And the reasons have been various. Some of them, we've had some pregnant staff who just did not feel comfortable, which we understood. We had some individuals who had new grandbabies living with them. They were concerned. It's been a multitude of reasons. And again, we don't judge, we don't ask, but if you're here, it's all boots on the ground. But however, we respect that too. So we do offer the compassion care.
Well, Denise, I have to say it. This is really about leadership. This is about having the right person at the helm with the expertise and just that good compassionate spirit to make sure that you lead not only the family health center staff, but the family and the overall community. So I want to personally commend you and applaud you for the excellent way that you have led all of us through this pandemic. I mean, there are some ways where we have fallen short overall in the community, but there's ways where we have risen above the occasion, and definitely Family Health Center has raised that bar and set that standard. So I applaud you for your efforts.
Oh, thank you. That means a lot. That means a lot.
So I gotta say it, when Black women lead, this is what happens. So, I want to talk a little bit about COVID-19 and the testing. So talk about, as this whole epidemic started, how had you were able to respond in regards to testing, and what are you all doing?
Excellent. Okay. So obviously, as this began to unravel, we were, with the rest of the public, we were looking at the news and seeing what was taking place. Naturally, by being a federal qualified health center, a lot of our connection comes directly from the federal government. And so we were directly keyed in as to what was happening across the country, what to expect. They were giving us very direct support, as well as very real conversations, what was taking place. And these are coming from all different angles, quite a bit coming out of MDHHS, out of the state. There was quite a bit coming out of the federal level through Dr. Fauci, many of you have seen, through WHO, World Health Organization, again, across the entire component. So one of the things that became clear to us, we began, screening for symptoms, as was many people. And one of the things that became challenging for us is the recommendation was to not bring individuals into the institutions. And the reason behind that, we understood, it made sense. They were trying to control the spread of the virus. The other component behind it, whereas we understood being in the medical environment, it from a, I don't want to say a business perspective, maybe from a scientific perspective, it made perfect sense. And it was actually very logical, but we figured out very quickly it was very, very damaging to the patients, and particularly our patient population. And what that was as people were calling in, because naturally they're scared. It's the first time they were hearing about it. It's this virus, it's this outbreak. They're hearing of these deaths, et cetera, et cetera. And people would call us because a lot of the visits we had transitioned to telephonic intentionally, because we're not trying to bring large volumes of people together. But we were being told, and the recommendation at that time, which is still the recommendation now, but we've been able to change it up a little bit, but the recommendation was tell people to stay home. So the mentality centered around that was stay home, do not come into the center. And it was stay home and self-isolate. And that's not, whereas that was, we understood the medical and the medical recommendation, and that was what was believed and still is best. That was very, very disheartening, very belittling, and very scary to our population. So here you have a group of people who have no idea. They're just being told about this virus. There's no cure. There's no there's no medication they can take. We don't know a whole lot about it. They likely have it. They're exhibiting symptoms of it, but we just need you to stay home and self-isolate. So we took it upon ourselves to go a little bit deeper with that and to explain to them. And I think this was the key component, that 87%, based on the data, 87% of the people who contract this disease do just fine. We don't like to, from a scientific base, compare it to the common cold or the flu, but that's the closest thing that we can associate it with the general public. So it's like a flu, we would help them to understand, and that more than likely, as you go through the symptoms, and these are what some of the symptoms will look like, you will recover just fine. If you do not, if it gets worse, then we would give them the numbers of where to go to the ER. But then we put processes in place where we would then call and check on them. We would put proactive pieces in place because, again, it felt so isolative to them. And patients really began to appreciate that. The biggest thing was the testing. People wanted to be tested. From the medical community, the thought was, even if we do test you, first of all, there was a huge backlog of tests. We didn't have tests. Tests were not available. They just were not available. And so it was a very, very select and minute few who were even obtaining the tests. We had very, very limited abilities, limited testing capabilities. So basically the mentality was, do not test unless you absolutely have to. And it would be based on these very, very limited criteria. Again, from the medical perspective and how those of us in the medical field were looking at it is, even if we do test you and it comes back positive, we don't have a medication we can give you. We don't have a vaccine we can give you. There is nothing different that we can tell you other than, yes, you're positive. This means that you can spread the virus, go home and self-isolate. So again, the mentality was, don't test them, just tell them to go home and self-isolate if they have the symptoms. Again, that did not work well for our population. They need to know. And so
we need to know.
Right, people need to know, and self-isolation is not as easy, I think, as we're all seeing. It's not as easy as one would say. That's A. And then B, depending on your living situations, oftentimes we have patients who are multi-generational, living in one home. You know, they may be carpooling, sharing one car. It's just a different familiar group. And isolation is not necessarily as easy said, as easily done as it is said. So we fortunately had regular dialogue with the governor's office. And as she was managing, and I think she's done a phenomenal job, one of her key components, and data came out and she asked us, what is it that you need? What is it that you need? And we said, we need tests. We need tests. These patients need to know. And this was asked looking at all the federal qualified health centers, which were centers like ours across the state of Michigan. So there are 45 centers like the Family Health Center all throughout Michigan, in Grand Rapids and Saginaw and Detroit, Battle Creek, et cetera, et cetera. And so she said, you know, what is it that you need? We said, we need tests. At that same time, and I think this part is key, she was also doing her due diligence, and she realized that in the state of Michigan, and this is very, very concerning to me as well as my team, we have noticed at this time that there were huge racial disparities associated with the coronavirus, things that we have not seen. We are very much accustomed to racial disparities, but the racial disparity, particularly in this virus, you have to understand, we really just started addressing this about a month and a half, 2 months ago. And for racial disparities to be so pervasive and so clear, it's very, very concerning. What the data is telling us very clearly is that 40% of the individuals who have died from the coronavirus have been African American. 40% of the deaths throughout the state of Michigan. So, you know, within the state, we've had about, I think we're about at 2,300, give or take a little bit, deaths throughout the entire state. 40% of those have been African American. We also know that upwards of 35% of all of the individuals diagnosed with coronavirus throughout the state of Michigan are African American. Yet, African Americans only make up 14% of the population. So it's very concerning if you have a group that makes up 14% of the population and they're comprising 40% of the deaths. So with that, the governor then sought out particular facilities that were in urban areas that cared for underserved populations, populations of color, Hispanic populations, et cetera. And she went to work. We did not have tests. She went and contacted and did some negotiations and set up a lab in Grand Rapids. It was a lab none of us had ever heard of. It's Next Gen MD, and got this lab situated. She got us lab kits. She coordinated us so that we got contracts with this lab. And today I am pleased to tell you this lab is providing us with as many tests as we need. That has been her directive. So they have a courier service. They actually come to Kalamazoo. They go to all of the various locations, but for us specifically, they come to Kalamazoo. They have a pickup time. They take all of the tests that we have done, and then they drop us off with more tests. If we need more in the interim, they bring more. So it has worked very, very smooth. They're guaranteeing us a 24 to 48 hour turnaround. Our last response, we are seeing that that was extremely quick. We don't expect that to continue, but that was about a good 18-hour turnaround. So it have been amazing, and very pleased that we were able to do that. So now we have the test, and so we are getting out testing the entire community.
So let's talk about accessing those tests. I know that you have started to do drive-through or drive-up testing. How can patients, particularly in Kalamazoo and our surrounding areas, reach out to access an appointment, or how can they get the testing?
Absolutely. So we have tried to make it as streamlined as possible, understanding that we are in a pandemic. So patients simply need to call one simple number. We have established a COVID-19 testing hotline. Again, to make it as efficient for patients as possible, they just call that hotline. That number is 269-488-0804. Once again, 269-488-0804. They call that line. That allows them to pre-register. They will speak with a registration staff who will take down some basic demographic information. It's important to know they do not have to be a family health center patient. They do not have to sign up and become a family health center patient. This is for all individuals within our community. However, the lab test is still a medical test, and it has to be ordered by a medical provider. So at the conclusion, once they do that brief registration, then they will be transferred to a provider, a medical provider, and the physician will do a brief interview with them. They just want to check their medical history, et cetera, and then evaluate the symptoms that they're having. They're going to look at various aspects of their current activity, and then make a determination if they're appropriate for the test. It is important to note that right now, because again, this is still very much state mandated, there are 3 criteria in which you can receive the test. If you are of age, so if you're of a high-risk age group, then we're testing you. If you're a senior, have high risk, or if you have what we refer to as comorbidities, meaning you have other compromising medical diagnoses, diabetes, congestive heart failure, hypertension, et cetera. All of those have proven not to do very well when mixed with the COVID-19. And so we want to make sure that we can evaluate that. So that would authorize you to take the test. They've just opened it up to minor symptoms. So if you have any symptoms associated with the virus, including minor symptoms, then we are now testing you. So minor symptoms can be anything from common symptoms associated with you can have a dry cough, you can have nausea. You may, we're finding that people are very tired. People are talking about being very tired, very lethargic, et cetera. So those types of things, to any mild degree, we will test you. Outside of having a mild symptom, we cannot test you. We still do not have enough tests just to test the entire general public, because people just want to know. At some point we may get to that, but we're still not there. We still don't have enough to test just because you just want to know. Not yet.
Well, let me
However,
this, because I get a lot of phone calls from individuals, especially that where they're working, where they're at their place of employment and someone has tested positive for the COVID-19 virus. So what if you get someone who work directly with this individual or in close proximity? They may not be showing symptoms yet, but they feel like they've been exposed. Will that make them be part of the crowd?
So not exposure, but you bring up a good point where we can still get around it, because the governor just released yesterday that all essential employees, so I think it's important to note that if you are currently working, then you are considered an essential employee. Correction, if you are currently working legally, then you are considered an essential employee, and you automatically, by way of the governor's directive just yesterday, have access to a test absent any symptoms. So those are the only individuals that can take the test and not have symptoms. It's what we refer to as asymptomatic. So you may hear people talk about, well, what if you're asymptomatic and you are an essential worker? So that's anyone currently working. You work in a grocery store, you work in a nursing home, you run a daycare, you work in a hospital, a healthcare facility, on and on and on. If you're currently working, mail carrier, currently working, and you may or may not have symptoms, you can have a test. You can be tested. And we will test you, and the physician will write you an order, and we'll get you tested and make sure you know, because again, she wants to make sure that people know their status, so then you know how to protect yourself, your loved ones, and ultimately the community.
What if you don't have any money or health care coverage? Can you still be tested?
So absolutely. We are the Family Health Center, and we provide care to all. We do not turn people away regardless of their ability to pay. For that process, it's important that you would contact the Family Health Center directly. You can still go through the COVID-19 hotline, but it's important that you inform the individual when you're doing the registration that you do not have health insurance. They will talk to you about the sliding fee scale. And then at that point, we will still test you. Family Health Center is doing drive-up testing and walk-up testing every single day at our particular locations. So we would not direct you to the drive-through location, but we would direct you to a Family Health Center location where we're giving the exact same test.
But that starts with that local number that they call, and then they'll be directed to that.
Correct.
Talk a little bit about your next drive-through testing, which I believe is tomorrow.
Yes, ma'am. So our next drive-through testing is tomorrow at Laura Norris High School. We will be there all day from 8 a.m. to 4 p.m. Again, open to the entire public, Kalamazoo County as a whole. Laura Norris, you just need to call that one single number, 269-488-0804. And we'll get you tested. We are upwards and expecting we have enough service and staff to accommodate 300 individuals. So we're continuing to ramp this up little by little, but we are there to service 300 individuals. First come, first serve. We have been selling out, if you will, scheduling out, I should say. So again, 300 people tomorrow at Laura Norris High School, 8 a.m. to 4 p.m.
So, you know, I'm going to be there with you. I love being there to support you all. But I want to just ask a question, because even my viewing audience here, there's a lot of diversity and inclusion. So if individuals have issues with language barriers, will you have interpreters? Will you have other folks that can assist with documentation, as well as, you know, being able to talk to people in various languages?
Absolutely. So we do make sure that we have that scheduled at each event. But when you register, if there is a particular language that you need, again, we ensure that we have Spanish on site, Spanish speaking. We actually have a provider who is from Dominica, but is very, actually Spanish is her first language. So very, very efficient in Spanish. But if you need another language outside of that, we commonly have Arabic as well. But tell us during registration so we can ensure that we have that. The other piece is that we do have access to the language lines. So we always have portable phone devices, and we'll be able to connect to, that's up to 150 different languages. That does require some navigation with COVID-19, because with this testing, it's all done in your car. And so we would have to, it doesn't make it impossible, but we do need to know ahead of time, again, so that we can set that process up for you.
So we're winding down for our last few minutes, and I want you to close us out with two things. One, with the very end, some inspiration to the people. But I like to, and I want you, as an African-American woman, not only leading a healthcare facility, but being conscious about the impact that not just this coronavirus is having on us, but health disparity issues overall. And knowing that the people you serve and the people that may be watching here today are individuals who are most likely to be impacted, and who could have the, you know, the most extreme outcome. what do you say to the community? What do you say to the most vulnerable people in our community? What advice can you give, and what empowerment can you give as well?
Absolutely. So, I want to start off that we are here for you. We care about you, and we sincerely mean that. It's a reason why we are located, and we've been right here in this exact same spot for the past 50 years. Now, many people say we have expanded and we've taken over and taken out a few roads and all of that, but we are right here. We're not going anywhere. And it's important that we continue to remain and connect with the community. With this virus, this is a pandemic, and it is very, very overwhelming to all of us. However, I think what people have to remember is that we have a significant amount of control as far as our ability in contracting this virus. Mm-hmm. From what we know, first and foremost, this virus can only enter your body. You only really can get it into your system 3 ways: through your eyes, through your nose, or through your mouth. Those are the only 3 ways that it enters into your body. Secondly, and probably most importantly, is what we find most is that the people, how it comes is we give it to ourselves. So that doesn't mean that, you're intentionally, but as you touch things, and so you will see us say blanket things, don't touch your face. What is most important, don't touch your face. The virus can live on various elements for long periods of time, days, way past hours. It can live on various elements for days. You will hear people talk about respiratory droplets. That's a very nice, fancy healthcare world. Healthcare, and I'm at the table with Stephanie, so I know I can be real. But those are healthcare words for what's commonly known as saliva or spit, and what we would refer to as mucus or snot. We call it respiratory droplets. So it's not large lumps and clumps. But you've all had times when people are up or people are talking to you, and those droplets will go into the air. It is common that those droplets are microscopic. You wouldn't even see them or you won't feel them, but yet they're going into the air and they can actually enter into you. More commonly, though, is that they're on a surface, and you touch the surface and you go and touch your face and rub your eye, and it's in. You go and rub your nose, it's in. You eat something with your hand, it's in. So what's most importantly is that you can address this. You have the power. We are asking all of you to please maintain your social distance. I know a lot of times, a lot of us cannot just quarantine. That's first and foremost. We would ask that you stay home and manage those requests. But if you can't, maintain your social distance, because you never know. One of the key elements that's coming out is where we're talking about these people who are asymptomatic. They have no symptoms whatsoever, but they are carrying the virus and they will pass it on to you unintentionally, but you would have no idea. They can pass it to you. There's nothing you can tell, that you can't look at them, you can't smell them, and know that they have it. They can pass it to you, and then you can be a carrier, etc. So social distance is very important. 6 feet. We have found that 6 feet is the parameter. As long as you stay within 6 feet of anyone, that is typically that's the distance that we feel is a safe space. And it's typically 6 feet, 10 minutes, but we don't need to go into that level of detail. Hand washing, basic hand washing. You don't need fancy soap. You don't need smells and widgets. Just wash your hands, but wash your hands. I mean, our hands around here look horrible. They're dry, and that's how your hands should be looking. If you got pretty smooth, beautiful wedding hands, you are not doing what you're supposed to do.
I know
wash your hands. Wash your hands. You cannot wash them enough. When you go outside, when you come back in, the first thing you should do is wash your hands. When you go to the grocery store, first thing, wash your hands. When you go to pump gas, first thing, wash your hands. We're encouraging people, if you have access, keep those wet wipes or Clorox wipes, or et cetera. You cannot wipe your hands enough. Your steering wheel, your door handles, et cetera, because those are all of the places where this coronavirus will get and live. And then again, it doesn't jump on you, but you touch it, and then you touch your face, and then we've had that contraction. So that's the other piece. Lastly, wear your face coverings. I have to tell you, one of the things that's breaking my heart, I am not seeing enough face coverings as I come into work and I leave work and I'm going about town. I see face coverings all over Kalamazoo County. I do not see them over here on the north side. We have to do a better job. It doesn't have to be a surgical healthcare mask. It can be a scarf. It can be whatever you desire. It can be the cloth, but it is important to cover your face. You need to cover your nose and your mouth, because again, you've got two key areas of how it enters. It protects yourself, and then it protects others around you. So again, face coverings are key. Those would be my key elements. Lastly, you know, I would say we are in this together. We are not leaving you. We have been through far more than COVID-19. We have been through pandemics before, and we will get through this. We will get through it together. Anything you need, you call Family Health Center. That's why we're here. We are your center. We are in your community, and we are here to serve you with dignity and respect.
And you know, we are resilient people. You're right. We have been through a lot, and we continue to overcome. And a great way helping us to do that is having partners in our community like you, Denise, specifically, and the Family Health Center staff. So I want to thank you for coming to the table and having the talk with me. And I hope that you come back soon. And I'm looking forward to talking about more of the great work that you're doing within this community, keeping us healthy, resilient, and vibrant. So thank you so much for being a part of what we do here in Kalamazoo.
Thank you. And thanks for all your work as well, Stephanie. Seriously, it's a pleasure.
I was going to tell you too, Mothers of Hope just received some more funding. I just was notified this morning. And part of that funding is to help provide some face masks.
Yay!
So the last time the organization gave away some laundry assistance, they also provided 125 face masks. They ran out in like, it wasn't nearly enough. So we're looking to get more donations, more support, face masks and face coverings, even for some of the children. So if you got a plug, make sure you plug us in. But we're doing our very best to help meet that need. So at least when people are coming into the facility or anywhere in the community, they can protect themselves with the face coverings.
Excellent. Excellent. Perfect. Thank you. And thank you for all your good work through you as well as Mothers of Hope. Thank you. Seriously.
Thank you. Yay. All right. We will talk soon. I appreciate you being at the table, and take care.
Okay. You too, dear. Bye-bye.
Bye-bye.